Wisconsin retail.
This conference will now be recorded.
The alcohol retail assessments done in the city and county of Milwaukee. So we will be exploring alcohol density, types of alcohol sold, and alcohol marketing. Please note that we are recording and we'll be posting the webinar. So if you prefer to change your name or turn off your cameras, please do that now. Okay, then next slide. Now for some introductions. I'm Brianna and I'll be your host today. I'm currently an MPH student interning at Community Advocates Public Policy Institute. Our other presenters will be Jackie Boards with Counter Tools and Hillary Joyner from the Population Health Institute in Madison. Next slide. So for an overview, we're going to be doing a background on the WRAP project, why point of sale matters, Milwaukee County health data, zip code level data, and recommended strategies. All right, so WRAP, or the Wisconsin Retail Assessment Project, is a project of the State Tobacco Program in partnership with Counter Tools. It started with tobacco retail assessments in Milwaukee in 2016 and expanded statewide with the option to add alcohol and food assessments in 2017 through 2019. Tobacco-free coalitions across the state conducted these retail assessments looking at advertising, product placement, price, and product availability. In Milwaukee, tobacco prevention groups, including the City of Milwaukee Tobacco Free Alliance, Wisconsin African American Tobacco Prevention Network, Hispanic Tobacco Prevention Network, and Poverty Network, wanted to determine whether there were disparities in product availability, pricing, and advertising. So researchers at the UW-Milwaukee Zilber School of Public Health analyzed the results by zip codes and organized clusters based on race, ethnicity, and income level. The results found clear differences by zip code cluster, and with more menthol marketing and more cigarillos in predominantly African American and Black zip codes, and more e-cigarette marketing and availability in predominantly white zip codes. We will be using the data from alcohol questions and focusing on alcohol disparities in this webinar. Why? Because alcohol use is the third leading preventable cause of death in the United States, with an estimated 88,000 alcohol-related deaths annually. And next slide, please. For some context, in this graph by the CDC, you can see that alcohol-related deaths in Wisconsin are increasing and are higher than in the United States. In 2017, Wisconsin was at 13.5 deaths related to alcohol per 100,000 people. Next slide. So we're going to do a little poll. Which of these things can affect your health? And then you can just enter your answer in the chat. Your zip code, your income, education, all of the above, or none of the above.
John, can you share what you're seeing in the chat?
Yeah, so it looks like we're seeing a lot of answer D, all the above, from just about everybody. It seems to be pretty unanimous.
All right, well, you are all correct. So the answer is D, all of the above. Next slide, please. All right, so why is this important? So it has been shown that Black and brown neighborhoods have experienced targeted marketing and increased tobacco and alcohol outlets, which ultimately impacts health equity. Health equity is the ultimate goal of equal and just health for all by addressing what factors are barriers to this goal. There have been a number of studies that have found disparities in alcohol outlet density, which does not give residents of these areas an equal opportunity to be as healthy as possible. These are some social determinants of health. As you can see, 50% of these determinants can be traced to where you live. It has become increasingly evident that your zip code can have a profound impact on your health. And health truly does start where you live, learn, work, and play. Next slide, please. So the 4 Ps of marketing are all about having the right product in the right place at the right price and how to promote it. Alcohol is an industry that also wants to make money, so health is not considered here. Their goal is to get lifelong customers hooked on their product. Next slide, please. And another poll. How much does binge drinking cost Milwaukee County each year? And then you can enter your responses or guesses in the chat.
We have 2 answered C, 1 answer for A, a few more for C, and a few for B.
Okay.
Yeah, it seems to be pretty divided between C and B.
All right. Next slide, please. All right. So alcohol costs us in more ways than one. Binge drinking costs Milwaukee County an estimated $594 million annually. And then 394.6 million of that is due to lost productivity, such as missing work. All right, and next slide. Binge drinking accounts for 76% of costs that are attributed to excessive drinking. Milwaukee County also has, on average, 20,515 hospitalizations, 767 crashes, and 481 deaths related to excessive alcohol consumption per year. Next slide, please. On the other hand, excessive alcohol consumption is not good for your health. It increases risk of injuries, violence, alcohol poisoning, and several other health issues that could be lessened just by reducing alcohol consumption, as implicated by reducing alcohol outlet density. In addition to the short-term effects, these are some of the long-term health effects of alcohol consumption. How many people think about alcohol being a carcinogen? Digestive problems, liver disease, and heart disease. These are just a lot of health implications caused by excessive drinking that are commonly not thought about. And with that, I will hand it over to Jackie Boards from Counter Tools to talk about why point of sale matters.
Okay. Hello, everyone. Can you hear me? All right. Good.
Yeah, we can hear you.
Okay, great. Okay. Hello, everyone. My name is Jackie Boards, and I'm a project director at Counter Tools. So here at Counter Tools, we have worked with Wisconsin since 2016 as part of the REP project or program, so the Wisconsin Retail Assessment Project. Milwaukee was one of the first areas we worked with. And today I'll be giving some perspective and some insight specifically around the point of sale, or POS for short, as it relates to the work done in Wisconsin. Next slide. Before we get into things, I want to give a little background on us at Counter Tools. We are a nonprofit organization based in North Carolina. We envision a nation where healthy living is equitable across communities and every person has access to healthful choices. And our mission is to empower communities to become healthier places. Here's a picture of our team. As you can see, we are small but mighty, as we say. We are a dedicated team of public health nerds, policy wonks, data enthusiasts, visionaries, and storytellers on a mission to leverage our expertise for productivity and positive social change. And also here is a snapshot of all of our current and past partners. Our clients and partners are government agencies, nonprofits, universities, and educational organizations in more than 20 states, as far west as California and as far east as Massachusetts. Next slide. As far as what we do, we work with our clients and partners to advance place-based public health and health equity through PSC changes, policy systems, and environmental changes. Our team provides consulting, training, storytelling, and technology, along with support, advocacy efforts, and help disseminate best practices. Our main focus is on the retail environment, or point of sale, or POS for short. So what products like tobacco, food, and alcohol are being marketed and sold in stores, and making way for policy change that can curb the impact of unhealthy products on populations. In particular, we provide in-person trainings and webinars on different topics related to place-based public health and the retail environment, or point of sale. We synthesize evidence and stories through creating communication materials, such as fact sheets, infographics, and maps. We provide mission-driven technology tools, such as the Store Audit Center and the Store Mapper, which I'll mention. We share research, news, and best practices through our Healthy POS webinar series, our podcast, our website, and many other channels, and we do much more. We have worked with Wisconsin since 2016, and we are definitely very happy and honored to be working with the state. Next slide. Now I want to start by giving everyone an introduction to point of sale, which I'll be focusing on today. Some of you all may have heard this term, some of you may not have, and I'll interchange point of sale or retail environment. They basically mean the same thing. So the point of sale, the retail environment, can be defined as brick and mortar locations where products are advertised, displayed, sold, and ultimately purchased by consumers, including food, tobacco, and alcohol products. So these are your local stores, also called retailers or outlets. You'll hear those words interchanged too. These are your local stores that you drive by, visit, and see in your local communities, including store types like convenience stores or gas stations, grocery stores, beer, wine, or liquor stores, mom and pop shops, pharmacies like Walgreens, your big and box stores and mass merchandisers like Target and Walmart, and your discount stores like dollar stores. So this is an umbrella term that mainly includes off-premise places where you buy products to take home and consume off the premises of the location. But it may also include on-premise places where alcohol can be consumed on the premises, like bars, clubs, and restaurants. I'll also be referring to off-premise locations today, but again, this can refer to on-premise or off-premise. Products like food, tobacco, and alcohol dominate this point of sale space. Today, we'll be focusing on alcohol. Every customer, young or old, drinker or non-drinker, who visits a store is exposed and cued by the glut of advertising for alcohol products and the sheer amount of these products available. I want to make a point by saying that in the current landscape with COVID-19, people are getting more of their alcohol from off-premise locations like stores, instead of typical bars and clubs that may have been closed during the pandemic. And people are buying larger quantities of these products since being more at home. So it is very important to talk about and consider the point of sale. Next slide. We have some more pictures on the screen. Yep. Now I want to talk about why the point of sale matters for alcohol. In order for us to be able to reduce the burden on health caused by alcohol misuse and abuse, we need to better understand how alcohol products are marketed, where and how they are sold, and in what communities. So I'm going to go through the 4 main reasons why the point of sale matters when it comes to alcohol, as you see on the screen. They are industry spending, underage use, excessive alcohol consumption, and density. Next slide. According to research, the alcohol industry is profiting a lot of money, billions, by keeping their products in stores and marketable. This high profitability provides financial support for a wide range of marketing activities that the alcohol industry can do to entice people to buy their products and keep buying them. According to market research, global retail sales of alcohol in 2017 was estimated at more than 1.5 trillion. I don't even know what trillion is. That is a lot of money. As of 2019, alcoholic beverages were the 8th most profitable sector. Putting this in context, Anheuser-Busch InBev, the world's largest alcohol company by volume, had 17.8 billion in net earnings, which was 31% of their total revenue. When accounting for point of sale, the industry is spending tons and tons of money, billions again, on marketing and promotions. According to a Federal Trade Commission report from 2014, including 2011 data from 14 alcohol companies, total marketing expenditures were estimated at 3.45 billion, and a large percentage of this had to do with the point of sale, in addition to other avenues like media. We're talking about billions here, people. So bottom line, the alcohol industry knows how to sell their products and does so in the places we visit every day, our local stores, and they make tons of money at the same time. Next slide. Now I want to go over underage use. Let's talk about the influence of the point of sale on youth. So alcohol is widely sold at stores like convenience stores. These store types are all around us, and who is visiting these stores? Well, all of us, right? But we can also call out youth specifically. I want to make a comparison to tobacco for just a second. So per a tobacco study done in 2011 through 2012, using a nationally representative group of 13 to 16-year-olds, it was found that almost half of these youth surveyed visited a convenience store at least once a week. What can be found at these convenience stores aside from tobacco? Well, food and alcohol products. So there is kind of a triple whammy. Also, the sheer low prices of alcohol, especially alcohol sold as singles or minis, advertisements for alcohol products inside and outside of retailers, often at a low level, and the flavor natures of these products appeal to youth. And it has been found through research that seeing more tobacco ads is shown to increase underage drinking. When talking about flavored products, we have seen that the alcohol industry is expanding their options at the point of sale. You are seeing your typical options like beer and wine, but there has been and continues to be a surge in the availability of other options like seltzers and hard drinks that are almost always flavored and heavily appeal to young people. These are your hard sodas, hard teas, hard lemonade, hard seltzers, and pre-mixed cocktails, such as brands like Four Loko, Lime-A-Rita, Smirnoff Ice, Twisted Tea, Mike's Hard, Truly, and White Claw, and many others. There is basically a product for any taste bud and preference, and these products are taking up much shelf and cooler space in stores. What this data tells us is that youth are routinely exposed and bombarded with advertising and have access to all types of products in these stores that they visit frequently, including adults too. And oftentimes these products are unhealthy products. This is cause for concern because youth are getting continually exposed and gaining access to products, thus leading to more of a likelihood of excessive and binge drinking and long-term addiction. Next slide. Now let's talk about excessive alcohol consumption. We know the more exposed you are to something, the more likely you are to use it, right? Same goes for alcohol. Exposure to alcohol products at the point of sale makes it harder for those trying to quit drinking to actually quit and makes it easier to start drinking. So this can lead to excessive alcohol consumption. This availability and visibility of tobacco products can lead to things like impulse purchases, especially if these products are in a visible location. And alcohol products and food products. So this availability and visibility applies to all types of products. Think of things like candy and gum. You're more likely to purchase them because they are usually at or near counters in stores and easily reachable. Same goes for alcohol. You usually see alcohol in prominent places and easily grabbable like in coolers or large displays. On the screen, you see examples of alcohol advertisements and price promotions in the exterior and exterior of a store, and just the sheer amount of products. Now ask yourself, is it hard to look away from this or not see these ads when you go into a store? Then think of, if you want easy access to products, how easy it would be to obtain them and keep going back for more. So consumption increases. Next slide. Lastly, I want to touch on density and alcohol outlet density. Alcohol outlet density is defined as a clustering and concentration of alcohol retailers or stores in an area. High density would be classified as a high concentration of these outlets in a small area. And density varies among different states and communities, and some areas have more alcohol outlets or stores than others. I point out this alcohol density, outlet density, because it is one of the main risk factors for many different adverse outcomes, including excessive alcohol consumption, increased injury, crime, violence, and disturbances, including higher rates of impaired driving, motor vehicle accidents, violent crime and assaults, and unintentional injury. It also contributes to underage drinking and increased disparities between groups. And I want to touch on this disparities piece a little bit. So studies have shown that alcohol retailer density or outlet density is higher in communities of color and in lower SES neighborhoods or communities. So for those whom are non-white and those at a lower income, then there are increased disparities in outcomes for these folks. So the availability of places to buy alcohol leads to people purchasing alcoholic products, and thus there is increased consumption leading to all of the outcomes I just mentioned. Next slide. Now I want to just talk about what was done in Wisconsin specifically. So in order for us to be able to reduce the burden on health caused by alcohol misuse and abuse, we need to know what data we have to determine the problems that are present in our communities. This is where the Store Audit Center comes in. Over 3 years, from 2017 to 2019, folks working under the REP project in Wisconsin collected data on what was being marketed and sold in their local stores. Across these 3 years, data was collected for alcohol specifically. In 2016, Milwaukee just collected data on tobacco, and then from these 3 years, data was collected on food and alcohol. The data was collected via the method of conducting store assessments and using the software tool we provided here at Counter Tools called the Store Audit Center. So basically what people did is using a survey form or an assessment form that had a set of questions to answer, they went into their local stores and filled out this form while at each store and inputted the data collected directly into the Store Audit Center. And next slide. So I want to talk about why it was really important for this to happen, why these assessments are very important. There are many reasons, but there are just a few on the screen. Well, first, to collect high quality data. When collecting data, you can identify where outlets are located, what products are being sold and marketed, and you can also identify disparities, such as differences between areas. You can use this data to figure out problems, right? Then you can document industry targeting. You can see how the industry provides marketing materials and such to retail outlets for prime placement of products and high visibility. This is oftentimes for a purpose of targeting certain groups. Assessments also allow for the identification of priorities. So using the data, what should be focused on, what policies and measures should be put in place can be determined. For instance, if there is a reduction in liquor stores, there may be a reduction in crime. Also, the information gathered via store assessments can be used to do some community education and educate stakeholders like policymakers. Next slide. So now I want to jump into the Milwaukee data specifically from our perspective at Counter Tools. So earlier this year, we at Counter Tools created a set of infographics summarizing the store assessment data for alcohol that was collected for counties in Wisconsin, including Milwaukee. This data was for all assessment data collected between the years 2017 through 2019, combined or aggregated. This is the first page of the infographic that we created on the screen. As you can see, in the infographic, we pointed out the types of retailers that were surveyed, the products sold at the bottom, as you can see, and the percentages for all of those. As you can see, convenience stores were very much popular, and as you can see in the percentages at the bottom, beer was the most popular product sold at these stores. Next slide. Here's the second page of the infographic. As you can see, here's some other measures that were figured out. So 65% of retailers sold single serving or minis of alcoholic beverages. 64% displayed or advertised alcohol within 3 feet or less of the floor, kids' eye level. And 54% of retailers had non-alcohol beverages placed in the same or adjacent cooler as alcoholic beverages. Next slide. So what does this data tell us? Well, this data tells us that alcohol is widely available in Milwaukee, especially at convenience stores. Beer was the most available product, like I mentioned, but flavored malt beverages were at a close second. So these are what I mentioned in the previous slide of these kind of flavored drinks, these seltzers and hard drinks. More than half of retailers had single servings or minis of alcoholic beverages. And more than half of retailers advertised alcohol within 3 feet of the floor or at kids' eye level. This point of sale data will allow people at the local and state level to gain insight into the alcohol retail environment and better understand alcohol-related health outcomes and disparities. And we'll talk a little bit more about the data later on, but this just gives you some idea of what was collected. There was a lot more data collected, but this kind of gives you a snapshot of some of the key points from the data. Next slide. So what can we do? There are many regulatory options that can be done. On the screen, you will find some things that can be done to limit the impact of alcohol at the point of sale. I don't have time today to go through each one of these in depth, but I do want to mention these as possible solutions. Generally, according to the World Health Organization, the WHO, the most effective interventions are increasing the price and reducing the physical availability and marketing of alcohol. And based on scientific evidence, to address this, limiting alcohol outlet density is one of the most effective strategies for reducing excessive alcohol consumption and other harms. And this can be done through regulatory measures such as licensing and zonings. So I really wanted to point that one out specifically because that is one of the most effective measures. But as you can see on the screen, there are many other ways to go about policy for reducing alcohol availability. You all can see that on the screen. Next slide. And I want to end with some resources, and I'm sure there'll be some more talked about later on in the webinar, but here are some resources that you all can look to for more information on alcohol and alcohol outlet density specifically. So there's this fact sheet, alcohol outlet density fact sheet, and the healthy retail playbook from Change Lab Solutions. There's an alcohol density report from the CDC and the Strategizer Action Guide on alcohol outlet density from CADCA. So I definitely recommend to check these out. And next slide. And here's our contact. If you have any questions or anything like that, feel free to contact us at hello@countertools.org. And you can also follow us on social media channels. And that's all I have. Thank you so much. And I hope you learned a lot about why the point of sale matters for alcohol, how it is important to do things like store assessments, and understand how change can be made to reduce the burden of alcohol. Thank you.
All right, thank you so much, Jackie. And now we'll be hearing from Hillary Joyner from the UW Population Health Institute, and we'll share data from 2 Milwaukee zip codes.
Hi, everybody. Can you hear me all right?
We can hear you.
Okay, great. You may also hear my 16-month-old son in the background, so if they're screaming or banging, nothing to worry about. So I'm Hillary Joyner. I am part of the evaluation research group at the Population Health Institute at UW-Madison, and I am part of the Strategic Prevention Framework Partnerships for Success 2019 grant. I see some familiar names on from partners that we work with on that grant to help reduce alcohol use in Milwaukee youth. So I want to preface by saying that we, as Jackie and Brianna mentioned earlier, we were planning to talk about racial disparities in the alcohol retail environment, and we did a bunch of work to try to identify if there were disparities, and we weren't seeing the same patterns as there have been from RAP data on cigarette use. So we're kind of going back and forth on what to present. And I thought it would be helpful to kind of take a closer look at 2 zip codes and talk about local data at the zip code level. So next slide, please. I have more disclaimers aside from the background noise disclaimer. So Jackie already mentioned that the data provide a snapshot in time. The assessments were completed as part of the Wisconsin Retail Assessment Project. And these are specific to the alcohol outlets that were scanned during those years. And we know that there's a lot of turnover in alcohol licenses. So especially in the past year, the alcohol retail market has changed a lot with COVID changing everything in our lives. It's changed, how people sell alcohol, how people buy alcohol. And also, regardless of that, there's been a lot of turnover in alcohol licenses in Milwaukee County. Additionally, stores may have changed since these data were collected. So stores turnover. I was talking to a colleague who was involved in the data collection, and he mentioned that even just the process of going through the audits made retailers rethink some of their sales practices. So what I'm going to present is kind of a picture of how things were when the assessments were conducted, and things may have changed since then, for the better, for the worse. You are the experts in your own community. So if I'm talking about kind of like the averages for the county and you think, well, that's not true of my area, you're probably right. And that's just kind of one of the caveats of talking about averages and county averages. So next slide, please. So I just wanted to highlight the 2 zip codes that I'm going to be talking about today. They're 53206, where 20 retail assessments were conducted, and 53208, where 8 retail assessments were conducted. The map on the left shows where the alcohol retail assessments were conducted in the county. The blue zip codes are what I'll be talking about. The gray zip codes are other areas where the assessments were conducted. And you can see the white zip codes are areas of the county where there weren't any assessments. So there were assessments conducted throughout the county, but not everywhere. And there were 140 total. So next slide, please. So countywide, 51% of the assessments were in convenience stores, as Jackie mentioned, 19% were in grocery stores, and 19% were in beer, wine, and liquor stores. And then there were a few other types like drugstores, vape shops, tobacco stores, that type of thing. And you can see that in 53206, the outlets were pretty similar to the countywide averages, but in 53208, there were fewer convenience stores and a little bit more grocery stores, beer, wine, and liquor stores. So if you dive down into the sub-county numbers, you'll see a little bit different findings. And when we were kind of looking at the trying to look at disparities between zip codes that have different racial makeups, it really seemed like the types of stores were driving the differences more so than the differences in different areas. So next slide, please. As Jackie mentioned, the beer and malt liquor, flavored malt beverages were the most commonly sold. So that in these bar graphs, the top line is the county average, and then 53206 is the middle line, and 53208 is the bottom line. And a lot of these are gray because there weren't really big differences. There's beer sold commonly throughout these zip codes and throughout the county, same with malt liquor and flavored malt beverages. We did see that in 53208, fewer retailers offered wine and liquor. And that's all I have to say about that one. Can we go to the next slide, please? So the next couple of slides look more specifically at those sales practices that Jackie discussed earlier, like selling single servings of alcohol or minis. And you can see the top line again is the county, and the middle line is 53206, which are highlighted if it's different from the average, and then the lowest line is 53208, which is again highlighted if it's different from the countywide average. And we found that selling single servings or minis of alcohol was the most common strategy countywide, and half or more of retailers in both of the zip codes we looked at saw that or were selling singles of minis, and in zip code 53208, it was slightly lower than the countywide average, but that could be due to the size of the retail outlets or the type of retail outlets. And then for single serving cans of alcohol beverages in the coolers, we saw that 53206 was slightly above the average. And then there were some differences in placement in the same or adjacent coolers as non-alcoholic beverages. But I think kind of the bigger picture here is to think about how common these practices are in both of the zip codes in countywide. So it's very common to see these sales practices in all types of stores, from beer, wine, liquor stores to convenience stores and other types. Can you go to the next slide, please? So alcohol displayed or advertised within 3 feet of the floor, and alcohol placed on end caps or freestanding displays were also fairly common countywide. But you can see in the, especially the alcohol placed on end caps or freestanding displays was less common in 53206. And it's still in a quarter of the retail establishments. I think, to me, what stands out for this is to think about the specific retail establishments in your area And the type of store, the size of the store, the type of products that they sell makes a big difference for their their merchandising practices. So if we talk about averages of countywide, it's very helpful, but when you are thinking about your own areas, it's very different to talk about the sales strategies that may be occurring in like a very small store in downtown Milwaukee versus like a grocery store in suburban Milwaukee. So all of these practices are fairly common, but it really makes a difference when you're talking about the specific stores. So can you go to the next slide, please? And then overall, as I mentioned earlier, the liquor licenses turn over a lot. So the scans that I'm talking about in these two zip codes were completed in 2017 and 2018. And zip code 53206, there were 20 scans completed, and only 14 of those scanned establishments still have a current liquor license as of October of this year. And there were 24 total establishments that have current Class A liquor licenses in October 2020, which means there were 1.1 Class A liquor licenses per 1,000 people in that zip code. Whereas in 53208, they conducted 8 scans. Only 5 of those establishments still have current liquor licenses. And in that zip code, there were 15 total establishments with Class A liquor licenses for 0.5 Class A licenses per 1,000 population. So next slide, please. And then when you put those on a map, you can see on the right side, the filled bubbles are the outlets that were scanned. And then the circles with nothing in the middle were outlets where there was not a scan, which could be because they weren't included in the sample or because it's a new establishment. So it's important to think about how quickly the licenses are changing in your area. And if there are opportunities to engage with retailers around their sales practices. As I mentioned earlier, I heard that just engaging in these retail scans got people thinking about these sales practices that you may be so surrounded by that you didn't necessarily notice. And conducting the scans is an opportunity to work with retailers, to build relationships with retailers, and engage with them around their sales practices, which they might not be thinking about as problematic, and to start that dialogue. I also wanted to mention that there are potentially opportunities to engage with partners that are involved in licensing and zoning. Because we're in a local control state, the liquor licenses are through the municipalities. So like the city of Milwaukee licenses alcohol retail establishments in the city of Milwaukee. So can you go to the next slide, please? This is my point here. You can get alcohol license data from your city clerk. So for the city of Milwaukee, you can use their license search tool. I've been able to find the West Dallas license data online. If you are from a different municipality, you might have to request the data from your city clerk if they don't have it, on their website. But this is public record, so you should be able to access information about where these licensed establishments are, how many there are, and then think about where they are in your community. Next slide, please. If you are in the city of Milwaukee, there is a handy mapping tool available on data you can use that shows the liquor license locations and the renewal information for all license types. So they have classes A, B, and C. It's a little bit hard to see, but there are these little dots on this map that they represent the different locations, and they're colored by the days until the liquor license expires. So if you're inside Milwaukee, the city of Milwaukee, and you want to see where the specific licenses are and how soon they're going to be up for renewal, you can take a look at this map, and it's pretty interesting to look at and think about, like, where are there clusters of stores, what are they close to, and just kind of take a peek at that if you have that available to you. Next slide, please. So this on the right is that map a little bit more zoomed out, so you can see there's clustering of establishments, in downtown Milwaukee and other places. So kind of my broader point is to think about the locations, think about the licensing of these establishments, think about the local context in your area and the conditions in the specific stores in your area, and think about how you can start building relationships or working with relationships you already have with retailers and with people who are involved in the licensing and zoning to make a difference in your area. And that is all I have. So I will hand it back to Brianna.
All right, thank you so much, Hillary. We're supposed to have a little poll slide here, but so if you wouldn't mind entering in the chat, who is in charge of alcohol licensing? The state, the federal government, or local municipalities? So go ahead and enter your guess in the chat.
We're seeing a lot of local municipalities. I think it's pretty unanimous. We're getting a lot of local municipalities.
All right, well, you're all right, so awesome. Okay, so how do we fix this problem of excessive alcohol consumption? The CDC and the Community Guide have suggested these options, and Jackie kind of already covered a few of these, but raising alcohol tax, regulating alcohol outlet density, reducing the legal blood alcohol concentration, which is currently 0.08, dram shop liability, which is where a business can be held responsibility for over-serving someone and causing harm, or for serving alcohol to those who are underage, limiting days and hours of sale, enhanced enforcement of laws prohibiting sales to minors, electronic screening and brief intervention, which uses electronic devices to deliver key elements of traditional screening and brief interventions. Electronic screening and brief intervention involves screening individual for excessive drinking and delivering a brief intervention, which provides personalized feedback about the risks and consequences of excessive drinking. Next slide, please. And then here's a list of 10 ways your community can create a positive alcohol environment composed by the Wisconsin Alcohol Policy Project. These are some ideas that community members can bring to their community leaders to help influence policy decisions to reduce alcohol-related disparities and other issues related to alcohol. Some of these ideas include limiting number of places that sell alcohol, raising awareness of the consequences of underage drinking, requiring responsible alcohol serving at events, among others. Next slide, please. And then Change Lab Solutions created this infographic to show how public health leaders can locally change the alcohol environment. This largely involves reducing alcohol outlet density in combination with community support for reducing excessive alcohol use and addressing the current problems in the alcohol environment, which will ultimately improve the health of communities. Next slide, please. And then in conclusion, licensing for alcohol retailers is handled by municipalities, not the counties or the state. So we have the power to locally address this issue. Some ideas from Julia Sherman at the University of Wisconsin Law School are municipalities can create guidelines for granting alcohol licenses, such as proximity to schools, other licensed outlets, and proximity to residential areas. Conditions could include small/amenity issues such as cleaning duties, no single serving sales, limiting the number of alcohol coolers, limiting alcohol advertisements, among others. Creating on-premises conditions such as operation hours, mandating that food must be served with alcohol, etc. Training staff to check for IDs and no over-serving at bars. Next slide, please. So the Milwaukee Blueprint for Peace also recognizes the harm in high alcohol outlet density. A statistic from their website states, neighborhoods with higher density of bars and alcohol outlets have higher rates of violence, including child maltreatment. In 2015, 6% of homicides and 7% of non-fatal shootings were tavern-related incidents. Goal number 5, to foster safe and strong neighborhood, calls for decreasing the sale of harmful products and reducing tobacco and liquor outlet density in priority neighborhoods as a recommended strategy to create safe and accessible communities. And we do have Jamal Smith in the audience, I believe. Jamal, if you would like to speak a little bit on that.
Sure. Good morning. Jamal Smith in the Office of Violence Prevention. And what you said was absolutely right in terms of the impact of higher density of bars and alcohol outlets, So convenience stores, liquor stores, we know that there's either a lot of violence that happens within those stores or outside of those stores. And, to your point of the 6% of homicides and 7% of non-fatal shootings happening in 2015, we understand that much of what happens within the neighborhoods in terms of there being such a high concentration of alcohol or alcohol outlets has been a replacement for a lot of other stores that could potentially be more beneficial for communities that could lead to the improvement of a safer and stronger neighborhood, which is goal 5 of the blueprint. So it's really getting people to understand the importance of being vocal and advocating for less opportunities in terms of convenience and liquor stores and alcohol outlets to decrease that density for there to be a lesser chance for violent incidences to occur.
All right, thank you, Jamal. And then for anybody who didn't know, Jamal Smith is from the Office of Violence Prevention here in the city of Milwaukee. And then we'll have John talk about small talks.
Yeah. Hello, everyone. Another great tool for prevention is the Wisconsin Department of Health Services campaign entitled Small Talks. It's a campaign created to address and reduce the underage binge drinking in Wisconsin. And as you may know, and we'll hear more, underage drinking is simply one aspect of the drinking culture, and the binge drinking that Department of Health Services and we're all trying to prevent. There are many risks associated with underage drinking. 65% of Wisconsin teens have tried alcohol, and 2 out of 3 Wisconsin teens don't see underage drinking as a risk. And what this campaign focuses on is to really highlight the importance of having conversations early with young people, as early as the age of 8, and understanding that having these conversations early and often, as well as really having honest conversations with young people, is one of the best ways to prevent youth trying alcohol for the first time. For more information, the website is below here at dhs.wisconsin.gov/small talks. And there's a lot of great resources on how to learn more about underage drinking and some other communicable resources to share with your communities.
All right, thank you, John. All right, and then here is just a list of resources that we compiled for informational resources about alcohol and alcohol outlet density and a whole bunch of other things related that you may find useful. And then that is the end of our webinar. And I'd like to thank every single one of our speakers for dedicating their time and expertise to help create this educational opportunity. And then at this time, we'll open the floor for any questions. You want to either type them in the chat.
We do have some in the chat. Jamal added the link to the Blueprint for Peace from the Office of Violence Prevention at the city.
Yes, and we do have that in our resource list as well. Any other questions from anyone? All right. Well, it doesn't look like anybody has any questions, so thank you everybody for attending. Oh, here's a question. Is there any pressure being put on big chain stores at the headquarters / national level to change their product display practices?
That might be something Jackie could speak to.
Yeah, I can speak a little to that. Yeah, so it's a little bit easier in general to kind of, for your kind of smaller stores, mom and pop shops, things like that, to ask them to voluntarily change their product display practices and things like that. So there is a little bit more leverage for your kind of smaller stores that are not maybe these big chains. But there is the option of kind of targeting these big chain stores, but that just requires more reaching out to headquarters and people like that. And you might get a no, you might get a there's other priorities from these big chain retailers, but there is that option. But I would say the most effective way is to kind of target your smaller stores and talk with them personally and go into those stores and have conversations. I've heard this from other states that we work with at Counter Tools that that has been effective and actually changes have been made. But yeah, when you're talking about these big chain stores, you do want to kind of reach out and see if you can get in contact with the headquarters or who's in charge and see if things can be done, because it's a little harder to do it for those type stores. But anything's possible. Hope that answers your question.
Jackie, there was another question. Is Counter Tools still available?
You can email us for sure. So definitely email us if you have any questions. We'd be happy to answer any questions. We're not currently working with Wisconsin in a large context or working with the department at this time, but there are, like I said, if you have anything that comes to mind, we are here. So just feel free to contact us, and we'll see if we can answer it. And if it's a bigger ask, then there might be some more things that need to be worked out. But as far as just general questions and things, feel free to contact us.
Okay, and then another question is, how would you go about empowering local communities and individuals in engaging in this issue? So that is kind of the question to ask. And then also with COVID and everything, it's hard to go out in the actual communities and engage individuals, but it's really just kind of collaborating with public health people and creating programs that kind of help include everybody and kind of getting everybody on the same page. And you're right, a lot of people don't actually know this is an issue. So I think that that's a piece of it too, is getting that education piece out there and kind of learning that people, even at the individual level, do have a voice and the power to kind of bring these issues up to their local municipalities to kind of address this issue. So thank you for asking that.
I'd add in something, Jackie, here, that a big way of we kind of promote at Counter Tools is focusing on certain themes, certain big issues. So as you all heard, there's the violence issue of these outlets and violence happening in and around these outlets. So that's something that I think is something that you can point out when you're engaging with communities and use that as kind of your basis for why this is important. So, violence, and then when we're talking about underage use, that's a big part of this all, is underage and youth getting access to these products and starting drinking early. So that's another way I would definitely recommend to kind of tackle this when you're engaging, is talking about that underage use. So those are just some ideas of just kind of focusing in on what are the big problems, and not, kind of trying to understand everything, but just kind of focusing in, I think has really been effective. And also engaging people when you're doing this work. So engaging youth, so getting youth, recruiting youth from schools and things like that to talk about this issue. I know with tobacco, that's a big driver of policy, is getting youth to talk about tobacco. So same with alcohol, is getting those people that are directly affected by this to talk and to use their voice, because we're all not experts, and we all, sometimes it's better, the voice is better coming from someone else, right? So I think that's another recommended way to empower people, is to involve them.
Thank you, Jackie.
I'm wondering if John could just say a little bit about the license hearings and how community members can get involved in those.
Yeah. So there are many ways that community members, community partners, and other individuals can act to affect licensing at the municipality level. As some of you may know, licenses come up for renewal every few years, depending on the type of license. And at those license hearings, there are public records that people can write letters, make phone calls, show up in person to testify, either in favor or in opposition to the licensing of particular alcohol retailers. So there's a couple different ways to get involved, but there is the ability to share testimony through phone calls, emails, written letters, to talk to city officials about licensing in your area.
If I may just add, this is Patricia Ruiz-Cantú from the city. I think also one important part that we could do is call your alder, the alder from, even if the alder is not part of the committee, the licensing committee, it's very important to contact your alderwoman or alderman, especially if you have been making phone calls and you have not received a response. So if you call your alder person, and then also the communication, it states which aldermen are part of the committee, and you could call their offices and express your feelings against or in favor of that particular retailer that's going to be in your area.
Absolutely. Thank you for adding that. All right. Well, if nobody has any other further thoughts, we will conclude. And thank you all for attending. And have a great rest of your day.